Good, happy Friday morning, April 10, 2020. I'm Riley King, and welcome to this morning edition of the Riley King Newscast right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, let's start off with your coronavirus disease, COVID-19 in New Hampshire, what you need to know. Let's take a look right now. And here is that COVID-19 in New Hampshire. There are 819 number of people in New Hampshire who have tested positive for COVID-19. 4,065,689 number of people in the United States who have tested positive. 21 number of deaths from COVID-19 in New Hampshire. 127 number of people who have been hospitalized with COVID-19 in New Hampshire. And 16,548 number of deaths from COVID-19 in the United States. This map of New Hampshire shows cases of COVID-19 in New Hampshire. In the towns and cities of New Hampshire, Nashua 76 cases of COVID-19. In this graph right here, new cases each day in New Hampshire in the purple, daily new positive COVID-19 cases in the orange, new hospitalizations, and in the red are the deaths. And your common symptoms, fever, cough, and difficult breathing, how it spreads, and prevention tips. Be sure to stay with the Riley King Network on the latest of your COVID-19 information. Social distancing in New Hampshire may be working, must be continued, health experts say. 3 more deaths related to COVID-19 reported. Let's take a listen to that video from WMUR News 9.
In this life, there are only so many things you can count on.
So many wonder when New Hampshire will see a drop in coronavirus cases. State epidemiologist Dr. Benjamin Chen says the predictive models are always changing.
We believe that there's a high likelihood for a potential peak in New Hampshire sometime within the next several weeks.
Today, Dr. Chan went through a slideshow of statistics showing the possible path of COVID-19 in the coming weeks. There are indications social distancing and the stay-at-home order could be making a difference.
Our New Hampshire strategy is showing some early signs of potentially having an impact on slowing the spread of COVID-19.
21 have now died in New Hampshire, with recent deaths connected to outbreaks in long-term care facilities.
So this is certainly a concerning trend that we're following closely.
Chan says the state is averaging about 400 tests a day, and hospitalizations are showing signs of leveling.
There will come a time where we will need to talk about relaxing social distancing, but that time is not now. If we relax our social distancing too quickly, we risk having the outbreak increase again.
It still remains to be seen how effective the mitigation efforts will be.
Where the curve ends when it finally hits zero, we don't know. But until then, we all have to remain very vigilant in terms of our responsibility to ourselves and our family and the public health and safety.
These predictive models and numbers could change so quickly, so at the very least, all these restrictions will remain in place for weeks to come. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. So new, 3.2 million raised for COVID-19 response. More than 1,300 volunteers stepped forward. Governor says response to call for volunteers has been awesome. awesome. Let's take a listen to that video from WMUR News 9.
Join Girls Inc. of New Hampshire to inspire all girls to be strong, smart, and bold. You can take part in our Girls Inc. 2020 initiative by bidding on awesome auction items right now. Go to Girls Inc.
Adam, the call to help went out a couple of weeks ago, and the governor says New Hampshire has responded, people donating their time and money. Sununu says more than 1,300 people have signed up to help those most affected by this crisis. Volunteers are matched with local nonprofits, and they have the option to help remotely or in person by running errands, picking up groceries, or dog walking. Sununu says safety and social distancing have been the priority in all statewide volunteer efforts.
When we come together, we make those sacrifices, we volunteer our time, donate where we can donate, understand that we are truly all in this together as individuals, as communities, as nonprofits, in the private sector. When we do that, really amazing things come.
And through donations by companies and people, Sununu says more than $3.2 million have now been raised for charities and families in need. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Sununu says if you feel more comfortable voting absentee during COVID-19 outbreak, you can. Governor cites flexibility of current system while awaiting formal guidance from AG and Secretary of State. Sorry about that. A little allergies this morning. Governor Chris Sununu said Thursday any voter who feels uncomfortable or nervous about entering a polling place if there are still COVID-19 related concerns later this year will be able to vote absentee under current law and procedures. Drops in overdose cases and deaths for New Hampshire's two largest cities has officials concerned. AMR officials worry people who need help won't seek it in fear of being exposed to COVID-19. Let's take a listen to that video from WMUR News 9.
Why choose Century Roofing? You've met my team, the best in the business. Is a lifetime warranty good enough for you? And payment options, financing is available, and we accept all credit cards.
Century Roofing, we got you covered.
March was a historically low month for AMR, which responded to just 29 overdose cases in Manchester, a drastic decline of 59 last March. It's a troubling statistic for first responders who are left wondering where these individuals are going.
Addiction doesn't go away overnight, so there are still people out there who unfortunately are addicted, but for whatever reason, we're not seeing the number of overdoses that we would normally see.
Over the last 365 days, overdose cases are down 29% in Manchester, while overdose deaths are down 11%. In Nashua, overdose cases are 14% lower, and overdose deaths down 16%.
We've seen peaks and valleys, if you will, over the course of the epidemic over time, but certainly nothing that's drastic.
One fear by first responders is that people who do need help are not seeking it because of fear they could be exposed to COVID-19.
We're doing everything that we can to make sure that when people come into a firehouse or an ambulance or any of the addiction centers that they're safe. We're following all the PPE guidelines.
Bottom line, Statewide says if you need help, seek it out. Do not let fear paralyze you from getting treated. Reporting remotely, Mike Cherry, WMUR News 9.
Okay, and there you go on that video and that report. As COVID-19 impacts businesses, New Hampshire commercial fishermen turn to boat-to-table approach. Portsmouth fishermen use social media to drum up business. Let's take a listen to that video from WMUR News 9.
In this life, there are only so many things you can count on. The sun rising every day is one of them. In 1 second, the sun generates more energy than has been used in all of mankind's history. Reliable, powerful, valuable. Granite State Solar, helping New England capture the power since 2008.
The rise of cases of COVID-19 has hit Andy Konchak hard. Right now, he and his captain, John Borden, can't sell lobster to their dealers.
COVID happening and restaurants closing down and dealers aren't buying from us anymore. We just knew something had to change.
They're now trying the boat-to-table method. Andy's wife came up with a Facebook page called Fresh Lobster Portsmouth NH to see if people were interested.
People were just super excited, and it grew from there. I mean, comments came in within seconds.
The page has now become their ordering system where people can leave messages.
There's some positives that come from such a negative situation, I guess, if you try to look at it that way.
With the help of a group called New Hampshire Community Seafood, Andy was able to pull some permits in order to sell in a parking lot on Pierce Island.
There has to be like regulations with, not a lot of people there, and then keep your space because COVID-19, you have to be 6 to 8 feet away.
2 days this week, people came to pick up their orders. They've sold dozens of lobsters already.
People were just outside in the sun, I think, happy to get away, wearing their masks, wearing their gloves, and just asking questions and engaging with others. And it was really nice to see.
Andy says he knows of many other fishermen who are doing the same thing to help keep their business afloat for now.
I'm just hoping that China and the community can get back to, the way that we used to be, because this is not just us that's suffering, it's everybody. So I just, hope for the best.
Reporting in Portsmouth, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Local doctor returns from treating COVID-19 patients in New York City. Tested before returning to work. Let's take a listen to that video from WMUR News 9.
At Beltates, customers will find everything they need for a building project. The brand names you trust to perform. And with a fleet of over 50 delivery vehicles, we deliver when and where our customers need them. Beltates Building Products. 9 locations throughout New Hampshire and Massachusetts.
People without heart disease, without lung disease, without diabetes, and yet they come in terrible, and they will need a ventilator.
Their fate, often grim. Did you actually see people die from this virus?
Oh, many. There were many. We were doing video conference calls. On the other end was this entire family who was watching their father, their mother, their brother, their sister die.
But Levitan, who has spent his career studying airway management, has found hope.
We can do less aggressive moves, like just trying to keep their oxygen up and positioning them and using special oxygenation devices and not put them on ventilators. In my experience, about 3 out of 4 patients can avoid a ventilator.
The doctor agrees with top experts that most people who get the virus will recover at home.
Okay, and there you go on that video. A New Hampshire physician has returned home from treating COVID-19 patients in New York City. The physician from Littleton Regional Hospital is one of the country's top emergency airway experts in the country. He offered to share his skills in New York. Every room, instead of being room 1, was now 1A, 1B, 1C, because we had no space, he said. He was able to go a little bit earlier before the surge. Chief Medical Officer at Littleton Regional Hospital, Dr. Edward Duffy, said. He helped out quite a bit, I'm sure, but he's also bringing back practical, real-world information about the critical care of this disease of COVID-19. One of the things that he said was surprised him the most were the types of patients he saw with the virus. People without obesity, people without heart disease, without lung disease, without diabetes, and yet they come in trouble and they'll need a ventilator, he said. While they found hope, we can do more, less aggressive moves, like just trying to keep their oxygen up and positioning them and using special oxygen devices and not put them on a ventilator, he said. Hospital officials said he was tested for the virus before returning to work. That test came back negative. Wuhan cautiously surges back to life after COVID-19. Let's take a listen to that video from ABC News.
Overseas, members of our team traveling to Wuhan, China tonight. That city now open, but with new rules and experimental technology allowing police to scan the crowd for body temperatures, looking for fevers. Here's our foreign correspondent, Ian Pannell, tonight.
Tonight, a city on the mend, surging back to life. This time-lapse showing just how quickly morning traffic has returned to Wuhan streets. But this is a new normal, one that keeps watch everywhere. Local police boasting of new technology deployed, helmets with a video thermometer they claim allows officers to scan the temperatures of more than 100 airport passengers in just 2 minutes. It's not clear if this experimental tech is a practical tool. Our team travelling from Beijing to Wuhan, seeing life firsthand after the 76-day lockdown was lifted. Nervous residents still wearing protective gear. Travellers even being scolded for not wearing masks properly. And now new signs requiring passengers scan a health code which will allow some to travel on the subway. Even on the Yangtze River, security checkpoints scan the crowd's temperature, checking phone health codes before allowing them in to view their own city's light show. Wuhan's revival comes as the UK is facing several more weeks of lockdown. Amid breaking news tonight that Prime Minister Boris Johnson has been moved from intensive care and is in, quote, extremely good spirits.
David, the government says that the lockdown stays in place until Britain moves beyond the peak, but the chief scientific officer is now saying that could still be weeks away. So Britain's very much in the dark tonight, with no end in sight. David?
All right, Ian Pannell, thank you.
Okay, and there you go on that video and that report. And also, the U.S. stock market is closed today for Good Friday holiday. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching this edition of the Riley King Newscast. I will be off air the rest of the day and all weekend long. I'll be back on Tuesday for another newscast. I'll be taking a nice little break of relax and relaxation. Have a great rest of your Friday, everyone, and goodbye. See you on Tuesday.